Whether it's you or a loved one, dealing with sleep apnea isn't easy.
So here to talk to us about this today, the risks, possible treatments, we've got 9 News medical expert Dr. Payal Kohli. Who among us does not know someone who's dealt with this, right?
Ladies, it is so common.
It's so common.
Yes.
So, I mean, I guess I know lots of people who have terrible sleep. How do we define sleep apnea specifically?
So apnea comes from an ancient Greek word that means lack of respiration or without breath. So in the medical literature, they've adopted it to mean essentially during sleep, you have lack of respirations, which leads to low oxygen levels. Now, there's 2 types of sleep apneas. One is obstructive. So I want to think about your airway like a straw, and somebody pinches off that straw. That's when the air is not getting in. Now, it could get pinched off because you have a big tongue, you have big tonsils, you have a thick neck, you're lying on your back, all the muscles relax. But that's what obstructive sleep apnea is. That's usually how we can tell when someone is snoring, and then they sort of startle themselves, and then they stop breathing. Central sleep apnea, that's a harder one. That's when your brain forgets to breathe. So it forgets to tell your lungs to breathe.
I was going to say, I didn't realize it was that serious.
That's a thing, yep. And it's more common here in Colorado because we're at altitude. So that messes with our brain's breathing centers. And so that's called central sleep apnea. So I have tons of patients in my practice that have one or a combination of both.
So you kind of spoke a little bit to how common this is, and it sounds like it's more common certain types in Colorado. Can you talk a little bit more about those general commonalities?
Yeah, very common. So 1 out of 3 Americans are thought to have mild obstructive sleep apnea, which is based on kind of how many times you stop breathing every hour. 15% are thought to have moderate to severe, and a lot of people don't even know it. But here in Colorado, if you have obstructive sleep apnea, it's likely to be worse because when your little straw gets pinched off, your oxygen can go lower because we have less oxygen in the air because we live at altitude. And the central sleep apnea, like I said, it can sort of disturb the brain and make it so you're not breathing normally. And so you have people who live at sea level, come here either for vacation or go up skiing, and they develop sleep apnea just because of being at altitude.
Are you diagnosing this because someone just says, I have terrible sleep, or my partner says I have terrible sleep, or is it always going to be go to a sleep institute, get the full rigmarole of the testing? How are you figuring it out?
So many times patients are not symptomatic, and me as a cardiologist, I look at the heart and I say, oh my gosh, you have sleep apnea because the heart is starting to change in a way that happens when you have untreated sleep apnea. Sometimes I'm chasing my tail on treating their blood pressure. I cannot get it down no matter how many medicines I throw at them because guess what? When their oxygen is low all night long, their body is in a stress response, releasing these stress hormones that causes high blood pressure, causes arrhythmias, causes heart failure, causes coronary heart disease like heart attacks, causes dementia. So a lot of times people will say, I've had a full night's rest, but I feel tired when I wake up. I have headaches first thing in the morning. Sometimes the partner tells me that I had to nudge them because they look like they're not breathing or they're snoring too loudly, you know? And so people think of it as just a snoring, but I don't want us to think that. It's really heart disease kind of coming across as snoring because it can affect all of our organs. And, we spend a third of our life sleeping. But if that third of our life is not good sleep with high levels of oxygen that's restoring our brain and our organs, it actually can affect that 2/3 of our life.
I was curious to know because you were talking a little bit about how, you could have somebody nudge you in bed being like, hey, like quit it. But for people who are living alone, it does sound like there are still some signs that they could wake up to and say, hey, I don't think I got the best sleep that I could have.
Yep. So if you've slept a full night and you're waking up feeling tired, you have those headaches, you have even potentially jaw pain, you have mood irritability. So especially for women after menopause, we're more likely to get sleep apnea, but it's more likely to present like anxiety or depression or persistent fatigue. Now, we don't always have symptoms, like I said. So for any reason your doctor tells you need to get a test for sleep apnea, it's an easy test. You usually wear something on your finger or wear a watch or wear a sticker that checks your oxygen all night long. You can do it at home, so you don't necessarily have to go to a sleep institute and do the whole thing. A lot of my patients are afraid to get the test because they said, I would die before I wear the mask.
Well, and that's where I want to finish in our final 30 seconds here is there are solutions beyond just this big elephant trunk mask, right?
Very much
like that's
so.
the most known, but
yes, that's the most common, most efficient solution, and usually for severe cases, but medications, even weight loss, even oral appliances that your dentist could make, like a retainer for your mouth that pulls your tongue out of the way or your repositions your jaw, can be used to treat it. Some of my patients that are really mild, I even say sleep on your side. So the poor man's sleep apnea treatment is taping a golf ball to your pajamas so that when you roll on your back, it's a little uncomfortable and you end up on your side. So
don't brilliant.
Don't be afraid to get it diagnosed because there are a lot of things we can do short of necessarily the mask, and some people obviously do need that mask.
Yeah. But sleep is, it's a major diagnostic. You gotta have good sleep.
Right.
Well, and it's funny because I joke with one of my patients who couldn't tolerate the mask, so he ended up having a surgery that has a remote control that can change your vocal anatomy. And so his wife often, when she says, I wish there was a mute button on this, but it isn't. But when he snores, she turns it on, and it's
That
his
is
mute
so
button.
funny.
Wow.
That family
Amazing.
figured it out. Dr. Coley, thank you so much for coming in and helping us walk through